Hello, this is Millie Keeve again, telling you information about side effects of medicines that may be psychiatric side effects and where to find the information so you can show your doctor, so that instead of possibly the doctor saying, no, this can't be the drug that's causing you to be depressed, for example, and then prescribing antidepressants, you may be able to prove to him that there is evidence that the drug could cause your depression. So we'll start with Dianette. Dianette is two chemicals, Cyproterone acetate and ethinylestradiol. I have been campaigning about the depression caused by this drug for many years because of your reports to me. 150 or more young women have contacted me to tell me how they've been depressed, weeping, self-harming, anxious, dropped out of university, relationships have broken up. I mean, it's really not just occasional. This happens to quite a few people. Some women obviously won't get these side effects, but we're all different, and it depends on whether we can metabolize the drug, whether it disperses in our body properly, and everybody's different. So you can't say that just because some person that you know doesn't get depressed, that your depression may not be caused by the drug. Anyway, the screen at the moment shows the Guardian newspaper pill under review over link to depression. This was Monday, the 8th of May, 2006. And this was closely followed by the MHRA putting a report on their own website about this. They were doing a review of the drug because I had nagged them for 10 years to do something about the fact that there'd been no warning since 2002 of the risk of thrombosis and the fact that the drug isn't licensed as a contraceptive, and people shouldn't be taking it for more than about a few months. Some people have been on it for years. The drug is called Diane 35 in some countries. I'm just going to move to the next screen. I just want to show you, sorry, I'll go back to the last screen because the way I got to this pill under review over depression was from the April website. The link to the Guardian is just down here from the page which is in the menu under the medicines list and underneath acne drugs Dianette. So you will find it very easily on the home page, from the menu of the April website. Now, the way to find the information about a drug like this would be to look on the drug manufacturer's data sheet. So we'll put Dianette here, and you can find the summary of product characteristics, which is the data that the drug company produces when the drug is licensed, and they have to update it as they find out about more side effects. The PIL, it says SPCs and pills. PIL is the patient information leaflet that you should get with your drugs. So when we do a search, we come up with the SPC here, which is produced by Bayer for Dianette. So we'll click on this, and you will find the name of the manufacturer at the top with the phone number. And here you will find undesirable effects. There will be contraindications and special warnings and precautions. Obviously, a major problem with this drug is the thrombosis, which is why France decided to ban it for a while they reviewed it. And they've decided it's the, well, I'll talk about that in a moment. Anyway, so when we come to the undesirable effects, 4.8 on the data sheet, we find we're looking particularly at the nervous system disorders, headaches, and which are common. Migraine, it says uncommon. But we come to the psychiatric disorders, and under the heading common, that's 1 in 100 at least people, it says depressed mood, mood altered. So this is a common side effect reported commonly. Libido decreased, less common. Libido increased, even less common. But this is quite important because here it does tell you that it's a common side effect, depression, depressed mood, mood altered. Just under here it tells you, and this is since the April campaign about Dianette, this is why they've had to put it here. Post-marketing reports of severe depression in patients using Dianette have been received. However, a causal relationship between clinical depression and Dianette has not been established. Well, they can put this here, but they do know that the contents of the drug contain Cyprostat acetate, which is well known to cause psychosis and depression in some people. Maybe in higher doses, but that is linked to psychiatric side effects. I must impress again, if you get any pains in your legs or you have a history of thrombosis, you should really definitely go to the hospital immediately and probably stop taking the drug right away. Now, the European Medicines Agency, this is their website, the EMA.eu, they did a review of Cyproterone and ethinylestradiol containing medicines, which is called Diane 35 in many countries, in Europe and in Australia. And here on this page on the EMA, the European Medicines Agency website, you can find all the information about that review. We did submit information to them, but they haven't put anything about the depression. Another site that's worth looking at is the MHRA. These people license the drugs in this country. They're meant to look after the safety of the drugs, and also they're meant to promote the industry. So they do have rather a conflict of interests, which was supported by the government inquiry, which was held in about 2005 into the influences of the pharmaceutical industry. But the MHRA try to do their best in the face of the fact that they do have this conflicting interest. They also promote yellow card reporting of side effects, and they did tell me to ask all the women who contacted April to report to them about the side effects of Dianette, which is why the psychiatric side effects to Dianette increased from 3% of all reports to 33% during the time and following our campaign. So when you go to the MHRA website, you can report your own side effects. Please do, because it's important that patients report, as less than 10% of serious adverse reactions are ever reported to the MHRA. Now, you can go from this site to the data sheet, which I've shown you on a previous video, for the drug analysis print. Now, the drug analysis print, which is on the MHRA website, you have to go from the safety information, which is here, to the medicines, to the drug analysis prints. And you will find they have a list here of drugs. And you click on the one for Cyprostat acetate. You have to sign that you understand it may not mean the side effects are. That's not the piece of paper I wanted. I actually wanted the I know where it is. I'm going to go into this now. Wait a minute. Cyproterone. So we have to click. We have to sign that we've read, which you must read because obviously that's important. That essential information about the drug analysis prints. You remember that the likelihood of experiencing a reaction is possibly not, well, it cannot be estimated from the information in the drug analysis prints. Please read this before you download this yourself. Anyway, here's the drug analysis print for Cyproterone, which you have to put, by the way, Cyproterone, because they don't have it under Dianette. But what it tells you here is that on its own, Cyproterone is called Androcur or Cyprostat, and this is given to men very often for prostate cancer treatment or overactivity, sexual activity, because it does reduce testosterone. When it's mixed with the product that prevents pregnancy, or you hope it does, it is called Co-cyprindiol. Dianette, or even Gynofen, but I think they've also got several other names for this drug. So when we look down here under psychiatric disorders, these are all the disorders you might suffer or that have been reported. Hepatic, there have been quite 241 reports of problems with the liver. Metabolic disorders, nervous system disorders, there have been 207. Psychiatric disorders, 559 reports. You can go further down the data sheet for the analysis of exactly what was reported, but they don't tell you the age or the gender. Well, in this case, it's mostly the women, obviously, with the Dianette. Anyway, that's a little bit of information for you, and I hope that has been helpful. I think that's about all. All I would say is please do report using the yellow card system, which is on the MHRA website, or you can go directly to yellowcard.gov.uk. I hope this has been helpful, and I do hope that if you suffer from depression and you are taking Dianette, you are not prescribed antidepressants, because that is not the solution to the depression that may be caused by this drug. When people stop taking Dianette who are feeling depressed, they believe due to the drug, most of them say the cloud lifts, I'm back to my normal self. And sadly, there have been cases of self-harm, attempted suicide, and suicide where girls have been given antidepressants following depression when they've taken Dianette, and they haven't stopped taking the Dianette until they have brought the attention of their doctor to the fact that the Dianette might be causing their depression. I feel very strongly about this drug because my late daughter took it and she was definitely very badly affected. And I have at least 150 emails from girls which I will be publishing for you to see eventually. Thank you. Millie Keeve signing off.